the DILALA trial. Welcome to today's episode, where we explore the details and significance of the DILALA trial, a pivotal Scandinavian randomized controlled study that has shaped the management of perforated diverticulitis. The DILALA trial was conceived to address a crucial question in acute surgical care. Can a less invasive approach improve patient outcomes for those suffering from perforated diverticulitis with purulent peritonitis? Traditionally, the go-to operation for these patients has been an open resection with colostomy, known as Hartmann's procedure. However, the DILALA trial investigated whether laparoscopic lavage, a minimally invasive technique involving the washing out of the abdominal cavity, could offer a safer or more effective alternative. To summarize the essence of the trial, here is what you need to know. The DILALA study, which stands for Diverticulitis Laparoscopic Lavage versus Resection, Hartmann's procedure for acute diverticulitis with peritonitis, recruited patients across multiple centers in Sweden and Denmark. All participants had acute diverticulitis requiring emergency surgery and were confirmed, during a diagnostic laparoscopy, to have generalized purulent peritonitis, what is classified as Hinchey grade 3. Importantly, the trial excluded patients with fecal peritonitis or contained abscesses. Patients were randomly assigned to one of two groups. The first group received laparoscopic lavage, where surgeons irrigated the abdominal cavity with at least 3 liters of saline, followed by the placement of a pelvic drain, without removing any part of the colon. The second group underwent Hartmann's procedure, which involved converting to open surgery, resecting the diseased colon, and creating a colostomy. Short-term findings. The primary outcome was the number of reoperations within 12 months. The short-term data, published in 2016, showed that laparoscopic lavage was safe in the immediate post-operative period. Short-term safety. There was no significant difference in morbidity or mortality between the two groups in the first 12 weeks following surgery. Improved short-term outcomes. Laparoscopic lavage resulted in several benefits over Hartmann's procedure, including shorter operating times, a quicker recovery in the post-anesthesia unit, and a reduced overall hospital stay. Hourglass with flowing sand. Long-term outcomes. The story does not end with the short-term results. In 2018, a follow-up at 24 months provided further insight into the durability of the laparoscopic lavage approach. Fewer reoperations. The lavage group had a 45% reduced risk of needing one or more additional operations within 24 months. Overall, these patients underwent significantly fewer subsequent surgeries compared to the Hartmann's group. Lower stoma rate. Only 3 patients in the lavage group had a colostomy at 2 years, as opposed to 9 in the Hartmann's group. This highlights a major advantage: avoiding a permanent stoma. Comparable safety. There was no significant difference between the groups in terms of the number of readmissions or mortality rates over the 24-month period. Impact on clinical practice. The DILALA trial provides compelling evidence that, for patients with perforated diverticulitis and purulent peritonitis, specifically those with Hinchey grade 3 disease, laparoscopic lavage is a safe and effective alternative to the more invasive Hartmann's resection. The advantages are clear: fewer long-term reoperations, a much lower probability of living with a permanent colostomy, and a faster initial recovery. Importantly, these benefits do not come at the expense of increased mortality or readmissions. In conclusion, for carefully selected patients with purulent peritonitis due to perforated diverticulitis, a minimally invasive approach using laparoscopic lavage is not only feasible but achieves better long-term outcomes than traditional open surgery with resection and colostomy. Thank you for joining us today. If you found this discussion helpful, please like, share, and subscribe. You are listening to the Everything Surgery podcast, where we dissect the extraordinary.